Thanks. 24 minutes after the hour, hundreds of kids hospitalized in 10 states across the Midwest with a rare and severe respiratory virus. It starts like a common cold, but within hours, it leaves kids gasping for air. It is reportedly very contagious. So will it spread? And what can you do to keep your kids safe? Let's ask pediatrician Dr. Mary Ellen Renna. Good morning.
Good morning.
So what is it that we're seeing?
Well, what we're seeing is a subtype of relatively common virus that we see called enterovirus. As pediatricians, we see this throughout the summertime and in the fall. This is a more severe subtype, and kids are presenting with colds and coughs and body aches and fevers. And in children who are immune naive, i.e. younger children, and kids who have more underlying respiratory illnesses like asthma or cystic fibrosis are presenting with a more severe form of it. So they're presenting with respiratory distress and requiring nebulizers and treatments and sometimes being intubated, having a breathing tube. So it can get pretty severe relatively rapidly.
Yeah, and when you hear the words gasping for air, that's scary, especially when it can be deadly.
Yes.
No reports of any deaths, though,
correct,
with this.
Correct. No reports of any death. It's in the United States, we have very good medical systems. So if a child presents where they suddenly have a high fever or they're coughing and they're having any type of difficulty breathing, obviously they need to get immediate medical attention.
And this is something that ebbs and flows, right? Are we starting to see this because all the kids are back in school and it's just like a big petri dish?
Absolutely. As soon as the kids get back into school, we see a huge uptick in viruses. And even when they're in camp together, whenever they're together, there's always uptick in viruses because they're touching their face and they're transmitting the virus very quickly to each other.
How do we know the difference between this and a common cold and the flu, and how do we treat it?
All right, that's a good question. So it's sometimes difficult to differentiate the symptomatology because the common cold and this particular virus are very, very similar. The common cold generally doesn't progress to severe respiratory illnesses, where enterovirus 68, which is what we're talking about as the cause of this illness, can progress into a severe illness. And the only way to really tell the difference is by testing with PCR testing. That's the truest way to tell.
But you start exhibiting symptoms, go to the doctor.
Exactly. If you start getting severe symptoms, always.
Dr. Mary Ellen Renna, thank you so much for your time today.
Thank you.